So I'm going to be talking about some work that my colleagues Eric Rice, Haley Weintraub, Shannon Dunlap, Craig Pulsifer, others at UCLA and USC have been working on for the past couple of years. And it has to do with developing geosocial networking interventions for young men who have sex with men. That's our target population. And I won't go too much into the rationale for this because Brian and Lynn have set up the importance of why YMSM should be targeted for HIV prevention approaches. This is a group in which HIV incidence is rising and we need to pay particular attention to. And I'd just like to take a quick informal poll. How many of you checked your cell phone within 10 minutes of getting up this morning? Just raise your hands and keep them raised. How many within 20 minutes? 30 minutes? An hour?
Oh, 1 minute.
1 minute, yeah, exactly. So I think this shows us how connected we all are to our technology, but young people in particular, as Margarita just told us, are especially connected. Between emerging adults, those young people in the ages between 18 and 24, reach for their cell phone within 15 minutes of waking up, 89% of them. And so, as Indu mentioned this morning, technology is more and more a part of our lives. It's going to be part of what we wear. It's going to be, part of how we monitor our home environment. And so, for young people, it's already so much a part of their lives, and as Margarita mentioned, so much a part of their identity. Young people are on their phones so much that there's Tumblr sites that are devoted to people staring at their phones. You can find that online. So young adults, in addition to smartphones, are using these social networking applications, social media like Facebook, Twitter, Instagram. And so for young men who have sex with men, one particular type of social networking technology that's being used are these what we're calling geosocial networking apps, but that specifically target gay, bisexual, and other MSM, and many of them are used for partner seeking. So this is just a couple screenshots from the App Store on iPhone. When you put in the search terms MSM, or probably not MSM, put in the search terms gay and social networking. You see hundreds of apps come up, literally. And these apps are targeted to particular communities. There's an app called Recon that's for fetish communities. There's an app called Growler, which targets the bear community. There's a new app called Mister, which has a code of conduct that members are asked to sign, which emphasizes maturity, integrity, safety, truth, enjoyment, and respect. That spells out Mister, and I'm sure that's the one we're all on. So these apps also have different features. So there's Scruff, which has a feature that allows young men or anyone who uses the site to find events that they might be interested in their area. There's a site called Recon, which allows users to post classified ads for everything from escorts to gym buddies. Adam for Adam and many of the other apps have search capability where you can type in that you'd like to filter out users between a certain age bracket or of a certain racial ethnic group or of a certain interest group. And there's a new app called Hornet, which has a feature called Know Your Status, KYS, which asks users to post their HIV status and the date on which they were tested, and then reminds them at 6-month intervals to be retested. So these are just some of the ways and some of the functionalities that are available through these geosocial networking apps that target gay, bisexual, and other MSM. So we focused our work on Grindr, which is one of the oldest and most widespread, one of the apps that's used most widely among MSM. This was an app that was originally launched in 2009, and some young men today will tell you that this app is very 2009. They've moved on to other things. As Margarita emphasized, technology changes very quickly. Oops. But here's basically what Grindr does for those of you who aren't familiar with it, and this is similar functionality to many of these apps. So you open up your phone and you click on the application, and a grid of users comes up, and they're oriented in terms of geographic proximity. So users who are most close to you show up in order. Now guys can post profiles and photos. They can link their Grindr account to Facebook and other social media sites, and they can send text messages and photos and even exact pin drops of their location within the app. Now, Grindr has that functionality, and it also has a division called Grindr for Good. And this is a part of the company that's devoted to promoting social justice initiatives. So for example, in 2012, Grindr launched a campaign to get LGBT issues on the phones of young men, to encourage them to vote on these issues in their area. But what we did in 2010 is we used Grindr to recruit 195 YMSM between the ages of 18 and 24. We stationed a recruiter in West Hollywood and in Long Beach, which are two neighborhoods that have high concentrations of gay men in Los Angeles. And we asked the recruiters to randomly select users based on the Grindr grid to send a text message inviting them into our study. If users were willing, then they were sent a link to a cross-sectional survey they completed once that gathered demographic information, information on their patterns of technology use, their motivations for using Grindr in addition to other technologies like Facebook. We asked about sexual health information seeking and ultimately acceptability of HIV prevention programming through various outlets. So this is what our recruitment looked like. We had about a 13% response rate, which is about comparable to studies that use banner ads for recruitment, and a little bit higher than what other studies that have used Grindr for recruitment have shown. And I'll just jump right on into our findings. So the mean age of our participants was about 22. The majority had received at least some college education. The sample was about 40% white, 33% Latino, 10% API, and 5% Black or African American. The majority identified as gay, and they also reported a strong attraction to males. And the majority of them were out to their friends, parents, siblings, and others. 75% of the YMSM in our study reported having ever had sex with a partner that they met on Grindr. And YMSM reported significantly higher rates of condom use with partners that they met on Grindr relative to those partners that they met elsewhere. So something important to note, that the majority of these men were practicing safe sex with their Grindr met partners. However, there were about 15% who reported UAI with a recently met Grindr partner, with a partner recently met on Grindr. And of those 15%, they had a higher number of lifetime sexual partners and a higher number of recent sexual partners. And so it seems that there may be a small group of guys using Grindr who are particularly important to target. And one of our challenges is figuring out how to target those guys. This is another paper that we published that just came out on these data. And the young men in our study told us that in addition to Grindr, they were using other smartphone apps, such as Jack, Scruff, Holloway. As you saw from the earlier slide, these sites have multiplied since we did our study. Participants use Grindr for many different reasons. A large percentage use them to connect to the gay community, to make new friends, to kill time when they were bored, to find dates. But the number one reason for using Grindr among the men in our study was to hook up, was to find romantic partners. We also asked guys what was the place that they went most frequently for health information, and we found that the number one place that guys went, perhaps not surprising after Brian's talk, is the internet. Less so to health professionals, family, friends, testing sites, etc. And then finally, the question that we were really interested in was, were guys willing to receive HIV prevention information through their smartphones? And 70% of the guys in our study told us that yes, they were. So we know that guys are using these technologies, that they're an important part of their lives and who they are. And so we think that our research has some practical implications for going forward and developing smartphone applications for YMSM. When we present these results to our community partners, a couple of them have told us that they already use Grindr for outreach and HIV prevention, that they station outreach workers on Grindr and make them available to users in their area to ask questions about HIV, provide information. We have thought about a lot of different functionality and are currently in the process of developing a smartphone application for, specifically for African American young men in collaboration with APLA and Online Buddies, which is another technology company that is used by YMSM. And I think this is one of the things that after hearing some of the presentations from this morning, I've really been thinking a lot about is how can we engage technology developers in the process of creating these apps or add-ons to these applications to target YMSM for HIV prevention. And I think that's a tricky thing. So one of the things that we've been told is that, you know, the technology development community has a different set of priorities. They're interested in users, attracting users to their technology, and they feel that if HIV prevention were to be put on that platform, that it would discourage users. And we're hoping to find out through interviewing technology developers if that's actually the case. But we do think that one place to focus going forward is really finding out from young men themselves what the functionality they'd like to see on these applications is. Do they want text messaging through the applications? Are we able to partner with the technology companies in order to be able to do that? Are there things that we can find out about the way that guys use these technologies to reach other men and to capitalize on that information for HIV prevention programming? So our colleague Haley Weintraub has a paper under review that showed that among the young men in our study, those who had been on Grindr longer, who had more Grindr Met partners, and who showed their naked chest or abs in their profile picture were more likely to engage in unprotected anal intercourse. So is there a way to tailor messaging based on the user characteristics? These are all ideas that we're working on. So I presented kind of very descriptive results, but I hope that these can be informative and that we can talk about these ideas throughout the day. Before I close, because I'm nearly out of time, I just want to thank our Community Advisory Board, the YMSM of Los Angeles who participated in our study, our study team, which includes Eric, Haley, Shannon, and Craig, who I've mentioned, who are here, but others as well. And I want to thank Grindr. So Grindr wasn't willing to partner with us for this study. We reached out to them a couple of times and really wanted to make that kind of corporate, academic research collaboration work, and we weren't able to do that. But Grindr only blocked our recruiter once, and they quickly reinstated him. So we were able to gather these data. And I think this just shows about the importance of these collaborations. And in our current work with Online Buddies, which is a division of Manhunt who has a mobile application as well, we've really started to kind of think through how can we make these partnerships work both for technology developers and those in the private sector and for researchers whose ultimate goal it is to improve the health and well-being of young men. So, thank you.